Temporomandibular joint disorders, or TMJD, are a group of painful conditions that affect the jaw joint and surrounding muscles and nerves. Although TMJD is not life-threatening, it can be detrimental to quality of life since the symptoms can be chronic and difficult to manage. The National Institute of Health estimates more than 35 million Americans are affected to some degree by TMJD. Those affected are typically between 20 and 40 years of age, and it is more common in females than males. A variety of symptoms are linked to TMJ disorders. Pain, particularly in the chewing muscles or jaw joint, is the most common symptom. People with TMJD can also experience jaw muscle stiffness, difficulty chewing, limited movement, locking of the jaw, or headaches. Treatments for TMJD range from simple practices, such as eating soft foods and taking prescribed pain medication, to wearing a bite splint, to more extreme treatments, such as arthroscopy and open joint surgery. One of the most traditional forms of treatment has been to prescribe a bite splint. While bite splints have helped to reduce TMJ pain, there are drawbacks with these devices. For example, they cannot be worn while eating, and they also affect speech, and as such are typically only worn at night while sleeping. There is a better solution. The TMJ Next Generation is a patented medical device that treats the TM joint at its nearest access point, the ear canal. It consists of two custom-made hollow ear canal device inserts that permit full passage of sound and provide comfortable relief for TMJD sufferers. The ear canal naturally changes size and shape when the mouth is opened through movements such as chewing and speaking. The TMJ Next Generation uses this anatomical change to provide a unique near-field treatment for TMJD. The TMJ Next Generation device can be up to or greater than 20% larger in its dynamic geometry than the ear canal when in a jaw-closed position. It is this change in volume or ear canal space that is believed to provide joint support as well as a unique cognitive awareness mechanism for the patient. The TMJ Next Generation device is made in 3 basic steps. First, the patient is examined by a healthcare provider to diagnose TMJD. Then, TMJ Next Generation can be prescribed. Once the examination is completed, an impression is made of the patient's ear canals. The impression of each ear canal is minimally invasive and can be performed by the healthcare provider, or the patient will be directed to a local certified audiologist. The entire impression process typically takes less than 20 minutes. After the ear impressions are complete, they are sent to TMJ Health's manufacturing location. The custom devices are produced and sent back to the healthcare provider in approximately 2 to 3 weeks. The TMJ Next Generation approach provides a simple, non-invasive, near-field approach to reducing the pain associated with TMJD. The inserts can be worn 24 hours a day and do not interfere with eating or talking. Most importantly, the TMJ Next Generation device is an effective solution. Studies have shown a significant pain reduction for those who have it. In addition to the pain reduction, 100% of subjects indicated good or excellent overall satisfaction with the TMJ Next Generation. TMJ Next Generation. Comfortable relief. Refer to tmjnextgen.com for more information. When the device should not be used, contraindications. You should not be fitted for a TMJ Next Generation device if you have active ear drainage, swelling, or redness, you have an unresolved history of ear pain unrelated to TMJD, or your ear canal anatomy does not allow for fit of the device, for example, too narrow or prolapsed or fallen canal or previous mastoid surgery. Risks and benefits. Patients wearing the TMJ Next Generation device in a 3-month clinical study experienced a significant reduction in the pain and dysfunction associated with TMJD, to an extent at least as much as that experienced by patients wearing a stabilization splint, mouth splint, or following a specified jaw exercise regimen. No unexpected or serious adverse events were reported, and a comparable safety profile to the stabilization splint, mouth splint, was observed. Patients in the study reported very high levels of satisfaction. Refer to tmjnextgen.com for more information.